So you're trying to decide if Zion Healthshare is a good fit for you and your family. In this video, we'll do a quick overview of everything that you'd want to know about Zion before signing up so that you can make an educated decision. So a few initial things to know about Zion is that they are a nonprofit healthshare, but they don't require any religious affiliation to join, which is important to know because a lot of health shares do require that, and Zion doesn't, even though their name does kind of sound like a Christian health share. It's that they're not. Their name is just because they're actually headquartered near Zion National Park. So even if that was a poor name choice, they're still a great organization. So a few other things to know. They're a little newer. They've been around since 2019. So some of the earliest health shares came out in the late 80s, early 90s. So these guys are a lot newer than that, but they have been growing really fast. So recent reports show that they're processing nearly $100 million a year in medical expenses. Part of the reason for their rapid growth is that their membership prices are very affordable. So to my knowledge, they're actually the most cost-effective out of all of the non-religious health shares. And even when you compare them with a lot of the religious health shares, they're neck and neck as far as their membership rates. Now, as I said, they don't require any religious affiliation, but they do still ask all of their members to adhere to standards of healthy living. So basically, that looks like staying away from illegal drugs and excessive alcohol consumption. And unlike some other health shares that won't let you join if you smoke, you actually still can join Zion if you're a tobacco user. They just have a $50 a month surcharge. Okay, let's move beyond just the general overview and talk about what using Zion actually looks like in practice. So they use, instead of a deductible, what's called an initial unshareable amount, or an IUA. And it works kind of like a deductible, but it's a little different, and I'll explain how. So you pick your threshold. You can pick from $1,000, $2,500, or $5,000. Let's pretend that you pick the $1,000 option. If any given medical event comes up, let's say you're hospitalized and it's a $10,000 bill, you would be responsible for the first $1,000. That's your IUA. At which point Zion would then help with sharing the remainder of the $9,000. But let's say that later in the year, something entirely unrelated to this happens, and you have a second $10,000 medical bill. Since it's unrelated, it would require a new IUA. So you would again be responsible for $1,000, and then Zion would help with the rest. Now, they limit it to 3 IUAs in a year. So let's say that you just had a really, really bad year. All of these different unrelated things kept happening to you, and you had, I don't know, 5 or 6 different medical events, each of which were over $10,000. You would only have to pay the IUA 3 times for the first 3 events, totaling $3,000, your $1,000 each time. And then after that, no more IUA payments. If anything else happens, it's just initially shareable with Zion from the get-go. So hopefully that makes sense. If you pick the $5,000 IUA, then your maximum risk is going to be $15,000 because you could have to pay it 3 times in a given year. Although I will say that having that many unrelated things that all exceed the IUA happen isn't super likely, but it's good to know what your max risk is. And one other thing that's important to know about this is that if subsequent expenses arise that are related to an earlier incident, then they're counted as part of the same IUA, so you don't need to pay that again. And that's good for up to 12 months following the initial incident. So that's the IUA structure. Now let's talk about what it looks like when it's time to actually receive care. So like a lot of health shares, Zion doesn't use a network. They have a no network approach. So that's awesome because that means you can go to any doctor, any facility, and you just present yourself as a cash pay patient. And that's really significant because the cash pay prices tend to be about half the cost of an insurance negotiated price from Blue Cross or United. So you get significant discounts when you present yourself as a cash pay patient, and then they send you the bills directly, the provider does, and then you just forward those bills on to Zion for sharing. Also, something that I would highly recommend, anytime you're not in an emergency situation, so you're able to schedule an appointment in advance, it's worth reaching out to Zion's team because they will go in and help you look at different providers and options and help you find wherever the best cash rate is. And that can save you a ton on your IUA. And it's also in their best interest to do that as well because that helps them keep their prices down, and that allows them to keep your membership rates down. And it's just good for everyone when you take the time to figure out where the best price is ahead of time. And Zion has great resources to help you do that. Okay, so now let's take a moment and look at what I would call the fine print, all of the things that you want to make sure you understand before actually signing up. So first, people always ask with health shares if there are any annual or lifetime dollar limits on sharing, and with Zion, there's not, except for with pre-existing conditions, which we'll talk about in a minute. But for just other incidents that are not related to a pre-existing condition that occur, there are no dollar limits. So they'll share up to however much the final medical bill ends up being, including on maternity care, which is pretty rare among health shares. A lot of them have a $100,000 or $200,000 cap, and Zion has no cap on maternity sharing. So that is something that makes Zion really attractive to couples who are expecting to have kids in the next few years. Okay, now what about pre-existing conditions? So pre-existing conditions are not eligible for sharing during the first 12 months of membership, and then after that, they're on a graduated schedule where each year Zion will cover a little bit more until year 4, when the amount that they offer caps out at $125,000 per year that's eligible for pre-existing condition related expenses. Now, a few things that go along with that: they have a 24-month look back period for what counts as a pre-existing condition. So if you've experienced a symptom or been treated for something in the last 2 years, then that could be counted as a pre-existing condition. But if something happened 5 years ago and hasn't resurfaced, then that wouldn't be counted as a pre-existing condition. And also, Zion is pretty generous with this, and they don't count diabetes, hypertension, or high cholesterol as pre-existing conditions. Now, just a few last things to go over here in the fine print section of the video. So unlike other health shares, Zion actually does cover some preventive services. So they'll cover 1 annual physician visit per year. They'll cover well child visits. They'll cover colonoscopies and mammograms once you're over a certain age threshold. And so that's something that a lot of health shares don't cover, and Zion has chosen to include as these are expenses that are eligible for sharing. Now, one other thing that's worth knowing is how Zion handles prescriptions. So prescriptions are only eligible for sharing during the first 12 months of that prescription. But after that, Zion does have what's called Zion RX Share, which is a service that's basically a marketplace where you can access extremely discounted medications. And so they still have a way for you to access ongoing medications in an affordable way, but that is something that's important to know, that if you have a chronic issue that requires ongoing medications, then the first 12 months of that will be shareable, and after that, it won't be. Okay, so a quick summary. If you're trying to decide if Zion is a good fit for you, they are the cheapest out of all of the non-religious health shares that I'm aware of. Medishare is a religious health share that for some age groups does have slightly better pricing than Zion. For other age groups, Zion is better. But Medishare has a PPO network instead of the no network approach that Zion has, which a lot of people will prefer to the PPO. So if you're looking for a non-religious health share, or you're looking for a no network health share, then it would be really hard to do better than Zion. They're a great option. I will also say that as a general rule of thumb, Zion tends to be pretty generous with their member guidelines. So for example, most health shares have a cap on maternity sharing, whereas Zion doesn't. They also have a pretty generous pre-existing condition schedule. So Medishare, for example, doesn't allow for sharing of any pre-existing condition expenses during the first 3 years, whereas Zion is only 12 months. So there are a lot of little situations like that where Zion could be seen as offering richer benefits than the other health shares, and you would expect that to make their memberships more expensive than they are, and the fact that they are still so affordable is pretty incredible. Maybe that's a temporary thing. They are still new. Maybe prices will go up in the future. I don't know. But at least for now, Zion is a great option for a lot of people, and I would have no problem highly recommending it.